Hi, it's Noel Williams from Optimal Health Associates, giving my weekly update on COVID-19 or the coronavirus. Hello to everyone who's been watching it, and I was going to try to switch it up a little each review. As many of you know, the COVID virus is increasing, and we're going to talk about that and why that's occurring. We're going to talk about traveling. We're going to talk about preventive steps. We're also going to talk about why anyone who says, what's the big deal? It's the influenza kills more people, how completely and totally misinformed they are every time they say that. So let's first talk about the update. So last week at this time, there was about 80,000 people infected with the coronavirus. Now it's about roughly 88,000. In the world, though, outside of China, there was about 1,600 people infected last week with 17 deaths. By the end of this week, there's over 6,700 people infected with more than 107 deaths. So we've had about a 400% increase in total cases and a 600% increase in death in 7 days. That's pretty impressive, actually, considering that countries all over the world are on complete lockdown and are very focused on it. So it just illustrates that this theory of pandemicness associated with the coronavirus is definitely coming true so far. And always remember, with the coronavirus, there's 7 coronaviruses. The ones that really mattered were the SARS and then MERS, which were like in 2002 and then 2008 or 10. And now this one. The other 4 coronaviruses that have been in humans for probably hundreds of years are really just mild cold flus or about at that level. They were first documented in the 1960s. I just want to remind everyone of that because there's huge differences between how any viral particle may be generation to generation. So that's the first thing. The second thing is, what can we do about prevention? Well, the number one thing for prevention is washing your hands and keeping one of these little babies, a Purell or something like a Purell, with you now when you're in public. It is essential to keep your hands clean. It's essential to try to avoid touching your face as much as you can, but we're all going to do that, so it's easier to keep our hands ultra clean. So washing your hands all the time and really becoming more of a germophile is going to be to your benefit. I've never been a germophile, so getting used to carrying this little Purell thing around with me is a change. I got on an airplane on Friday to go to a conference where I was speaking on something else, exosomes, and I brought one of these with me, the Lysol wipes, and I wiped down the seat and the armrests and all part of where I was sitting. And I think that's something people who travel really need to start getting in the habit of, because you don't know who was sitting there before you, and you don't know if they had corona, but more importantly, they may have just had a cold virus or a flu virus, and you want to be pretty protected right now. So these are your first 2 components. Besides just soap and water and being smart, is this. So then the other are these 2 things. But the other question is, where do masks fall into this whole rigmarole? And I have a N95 mask. This is what I wore on the plane because I was coughing, not so much because I was worried about corona, but I thought to be polite I would do that because I didn't want everyone to think they were going to get sick because of me. But the Surgeon General said, we don't need to wear masks and today, along with several other quote-unquote authority figures in the healthcare establishment and the government. Now let's remember for a minute, who said the coronavirus wasn't really important a month ago, or 6 weeks ago, and then a month ago, and 3 weeks ago? Oh, that would be those same people. So I would be very suspicious of anything they say or recommend, because they have different agendas than I do, which is to save as many people as we can from this. So who needs, or what did the Surgeon General say about masks? He said, 1, only high-risk people. He didn't define that group, I will. And he said that it could perhaps, they intimated, increase your risk for infection because you're going to touch your face more, and there could be contaminants on the mask. Well, let's think about the first group, or the first thing. Who's a high-risk patient? Anyone over 55? I'm 55. I'm a high-risk person for death from the virus. I have a much greater chance than people younger. But then it escalates at 60, 70, and 80 much more. So anyone over 55 is a high-risk person and should consider a mask when they're traveling or going into a large crowded group. And then anyone with diabetes, anyone with hypertension or cardiovascular disease, anyone with lung disease, anyone who's had radiotherapy or chemotherapy for cancer, anyone who's on ongoing immunotherapies for organ transplant or any rheumatologic diseases, those are all extraordinarily high-risk patients or people, and so all of them need to be wearing masks. He, of course, didn't say that because they don't want people to panic, and if we see more people wearing masks, people are going to get more nervous. That is always the agenda, and that's the agenda from the administration because they don't want the stock market to fall further. But our number one concern is protecting people. So if you're traveling, I'd wear a mask if you're on an airplane or in an airport or you go anywhere crowded. Now, are masks perfect? Are they going to prevent every single infection? No, but they're a darn sight more effective than not wearing one if you're by someone who's coughing who happens to have any viral particles. The thing about these N95 masks is there's an inside portion here, and you put this little filter in called a PM2.5, and these last a week at a time in terms of 7 days of use. So you could use it one day, use it another day, not use it for a few days, but 7 days per one of these. Again, it is not going to be completely protective, but it can be helpful. And that's what you want to focus on, is you want to limit your risks. And then the final thing with prevention is the zinc. So Dr. Norman Imes called me on Friday to go over zinc with me because he saw I was doing it, and he wanted to make sure, and he wanted to talk to me. I was a little nervous because Norman was, he's semi-retired now, but one of the best critical care pulmonary doctors in Oklahoma City, and it was really because of him through another doctor that I got all the zinc stuff figured out. And he said I was giving all the right information, but he wanted me to emphasize the immediate treatment strategy if you start feeling sick. And in his experience, his protocol was, at the first sign of cold symptoms or flu symptoms, you need to get in 200 milligrams of zinc as fast as you can, and he recommends about 50 milligrams every hour over 4 hours to 5 hours. The issue with the zinc gluconate, which is again the one he emphasizes as the best choice, is it can be nauseating, so you have to eat food. But he said in his experience in his patients that protocol worked phenomenally well for just curtailing it immediately. And so where it can get confusing, which pretty much happened to me on Thursday, I thought, I was getting allergies, so I didn't crank up my zinc because cedar was up. And by Friday, I was like, oh no, I'm starting to get a cold, and I'd missed my opportunity to really knock it out completely, because you have to hit that first 12 hours with the first 12 hours of symptoms to crank up the zinc. Now I'm already getting better, and so maybe this zinc shortened it, the zinc I did have on board, but I think if I would have figured out it was actually a cold I was getting and not allergies, it would have worked even better. So again, zinc, 50 milligrams a day. If you're having a problem with taking the zinc, you can get a 15 milligram tablet and take it 3 times a day. The tolerability is significantly better by doing that. It's just always for anyone who's a provider. We know as we spread out increments of doing medicines or supplements, it's harder for people to achieve. So those would be, again, the standard thought processes for prevention and from getting sick. Again, the multivitamins a great idea, what we carry, the Midas Strength, to get your immune system revved up too. And we're in pretty good shape going forward. Now let's talk about travel. Travel is, I think we have to look at it in 2 ways. One, is it safe? 2, is it going to be hassle-free? And the problem now with travel is if you are going to go anywhere where there's risk of coronavirus, you are not going to be allowed back in the country. A patient texted me tonight who's in Europe with her husband doing a business event, that their son, who's in the University of Arkansas Rome program, let them know that the University of Arkansas had terminated the program. They were going to all come back from Rome this weekend, but as the administration has put in the pre-leaving testing now, they're all having to go get pre-tested, have to spend 14 days on a military base in Italy before they can come back and where they'll get retested. So if you're going to go anywhere where there is coronavirus, figure you're going to get quarantined moving forward. And so I would be very careful about traveling in that, due to that, because who wants to be quarantined that long? Plus, the real length of time for quarantining people should probably be 21 days or 28 days, which I think is probably going to happen in the near future. So that's a good summary of what the update is. The virus is definitely proceeding along the course that the computer models have indicated. Unfortunately, we're still hoping that it won't, but we'll have to see. The warm weather thing, people have said, oh, with warm weather, this virus will peter out. Doesn't seem like that is as likely due to the mutations and the genomic patterns. But the thing to keep in mind too, it may peter out in the spring and the summer, but it will then come back much worse next year. Next year is going to be a really troublesome year too for this. It could be even worse than this year. So we'll just worry about that later. So that's what I have to give you so far this week. Any updates that have gone on. So take care. Please feel free to look at any of my prior videos. And if you have any questions, please send them in via Facebook. Take care.